Our hospital systems are feeling that. The big three in Northeast Ohio today put out a joint statement announcing some changes. Sarah Shookman has details.
All three of Cleveland's hospital systems are uniting in the fight against a new surge and putting off procedures that are not urgent and could take up bed space.
We are going to hit the highest number of cases, and it's not going to peak for probably another 2 to 3 weeks.
It's not just COVID patients, but those with other serious illnesses who may have delayed care earlier in the pandemic. And they know more are coming.
I think we're in a wait and see time right now. We'll have to wait and see what happens over the next 4 or 5 days.
Even if new cases level off in the next 2 weeks, they expect to see coronavirus hospitalizations up and to learn much more about the Omicron variant. If it's anything like Delta, it could take over by the 1st of February.
So when you have a virus that has a replication and transmission advantage, it will take over very rapidly. So I would say stay tuned.
This isn't the worst they've seen. That was last winter.
I don't think it's going to get quite as high, and that's because of the number of people vaccinated in Ohio.
If your vaccination is complete and you're boosted and you're masking and distancing, you're doing everything you can. And we thank you for that, because you're not only protecting yourself and others, but you're helping us in the hospital and our caregivers who are really stressed.
Dr. Amy Ray with MetroHealth says if you're still weighing a COVID vaccine, consider the why.
I guess now is the time for me to say this out loud. We do not have a magic bullet treatment for COVID-19. My job is not to judge you whether or not you've been vaccinated. I want the best for you. It's my duty to offer you the best.
And that's the vaccine.
And that's the vaccine.
Well, Ohio trails many other states in overall vaccination, but we have been strong in vaccinating those over age 65, about 85% of that group, and half of that population has already been boosted as well. We're hearing the booster brings the antibody levels higher than they were even after that second mRNA dose, Russ, which is thought to be preventative against severe disease with any variant, including Omicron.
That's some great advice there. What else can we all be doing?
Well, today I heard, this is the same advice that we've been hearing for months, whether it's Omicron or Delta. It's the same stuff. It's masking, it's social distancing, but that doesn't mean we're doing it. The mandates aren't likely to come back, but it's perhaps time to stop letting your guard down and start wearing your mask.
So it's true. Okay, Sarah Shookman, thank you very much.